Assalamu alaikum. Hello, everybody. So I'm back with a new series. I thought I'd just do a quick introduction to explain what it's all about. So my new series is about mental health and dealing with challenging situations. I find that in my practice as well as my online teaching that there are many youth that could do with some information about what mental health is and how to deal with challenging situations. So I hope you find it beneficial. Let's get into it. I honestly hope and pray that my experiences, as well as my qualification in psychological counseling, life coaching, and education, can at least help one person, even in a tiny little way. So, inshallah, say Ameen. Mental health goes back as far as the days of Adam and Eve, living their lives and then being faced with a challenging situation. Western literature on mental health goes back as far as the 4th and 5th century BC, discussing Hippocrates' contributions with mentally ill individuals, his patients. In my experience, I've noted that within Muslim and other religious societies, the stigma attached to mental health. However, psychology in Islam and other religions is practiced on the daily, in everyday practices, but just under various fronts, such as practicing of the religion. Islamic psychology, or the science of the nafs, is the philosophical study of the psyche from an Islamic perspective, which touches on psychology, neuroscience, philosophy of mind, that is a branch of philosophy that studies ontology and nature of the mind and its relationship with the body, psychiatry and psychoneuroimmunology. Now, that is the study of the effect of the mind on health and resistance to disease. And here we can think of individuals or even ourselves and how we are responding mentally, emotionally, and physically to the pandemic we find ourselves in. How do we define, diagnose, and classify mental disorders? Example, when does being nervous for a test become an anxiety disorder or AD? And when does being a neat freak become an obsessive compulsive disorder, OCD? The WHO, or the better known as the World Health Organization, started to standardize and measure these type of disorders on a classification scale. So in 1994 it started and it's ongoing. In 2013, the DSM-5 was established, and the DSM-5 stands for the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorder. What a mouthful. So we call them axes, and over here I'll attempt to explain what each axis is classifying. So on the DSM-5, axis 1 describes clinical syndromes. It was established in about 1952, and it touches on mood and anxiety or even eating disorders. Axis 2, we have your personality disorders and your mental retardation. It was established in 1968, and that covers personality, whether it be antisocial or histrionic personality disorders. On axis 3, we've got general medical conditions, example, HIV/AIDS and brain injuries. Axis 4, we're talking about psychosocial and environmental problems, for example, divorce, unemployment, death of loved one, etc. Your daily living issues that becomes mammoth, it becomes so big that it becomes a disorder. Axis 5, here we have the global assessment of functioning, where the clinician gives the impression of the client's overall level of functioning. And it is based on this assessment, clinicians could better understand how the other 4 axes interact and the effect it has on the individual's life. It can be difficult to find the things that will help you, as different things help different people. It's important to be open to a range of approaches and to be committed to finding the right help and to continue to be hopeful, even when some things don't work out. Yes, we can all suffer from mental health challenges, but developing our well-being, resilience, and seeking help early can help prevent challenges becoming very serious. It is often more realistic and helpful to find out what helps with issues you're facing. Talking, counseling, medication, friendships, exercise, good sleep and nutrition, and meaningful occupation can all help. Challenges or problems with your mental health can arise from psychological, biological, and social issues, as well as everyday life events. The most important thing is to talk to someone you trust. This might be a friend, a parent, caregiver, colleague, family member, or even your GP. In addition to talking to somebody, it may be useful to find out more information about what you are experiencing. These things may help to get some perspective on what you are experiencing and be the start of getting help. If your beliefs, thoughts, feelings, or behaviors have a significant impact on your ability to function in what might be considered a normal or ordinary way, it would be important to seek help. While this may depend on your relationship with them, gently encouraging someone to seek appropriate support would be helpful to start with. So some people may advise you on good evidence of what works with the best of intentions, but it's important to find out what works best for you.